The federal government charges monarchs to educate their subjects on COVID-19 vaccination, which aims at curbing the spread of the pandemic. Speaking on Monday at the third quarterly meeting of the Northern Traditional Leaders Committee on Delivery, the executive director of National Primary Health Care Development Agency, Dr. Faisal Shaib, said last week, "We completed 1 year of a wild polio virus-free country. This achievement is due to the collective efforts of all of you, our fathers, steering the boat of leadership to ensure vaccination is widely accepted by all."
Among others, perhaps it would be useful to start by refreshing our minds on the 4 cardinal commitments to a sustainable primary healthcare system in the Primary Healthcare Declarations of Alma-Ata in 1978 and Astana in 2018, which include 1. Making bold political choices for health across all sectors. 2. Building sustainable primary healthcare adaptable to each country's local context. 3. Empowering individuals and communities. And the last one, aligning stakeholder support to national policies. It is evident that this high-level engagement with the NTLC is in line with these commitments and indeed the right direction. The antecedents of the traditional institutions in Nigeria is replete with very good examples of the successes recorded in implementing public health interventions. The role of the traditional leaders in the eradication of diseases such as smallpox, guinea worm, and lately polio are some of the examples that rarely come to mind. Your Royal Highnesses, you are able to achieve these results because of your unique positions as traditional leaders and custodians of our society. This uniqueness places you as the entry point on the pedestal of delivery of quality primary healthcare services, especially as Nigeria has committed to achieving universal health coverage and health security through primary healthcare revitalization, routine immunization, and surveillance. These, you are aware, are the foundations of the current implementation of the 9-point next level agenda in this country. Key to mention of the policies that is driving this agenda are the primary health care under one roof policy, the basic health care provision fund, and the compulsory social health insurance schemes. Your Royal Highnesses, making progress in these initiatives would not only need your blessings as traditional rulers, but will also need your follow-through in terms of monitoring and accountability. This is even more relevant at this time when COVID-19 pandemic has exposed all global health systems, particularly the weakened PHC infrastructure and resources. We anticipate that this meeting will rekindle the spirit of volunteerism and caring for each other in our communities to sustain improved PHC services. I thank you and wish you a successful deliberation.
As always, it's a great honor to be in this forum, and I congratulate you, Chairman, for convening this forum, and especially the title of this forum, the Third Quarter Forum, about building primary health care in northern Nigeria. The NTLC was a game changer in the wild polio eradication and will continue to guide the communities on the importance of immunization, maternal and child health, prevention of child marriage, and other issues important to women and children. Immunization, though, is not only critical for children, but now also for adults. COVID-19 vaccine is our way out of the pandemic. It is safe, it is effective, and the best way to bring Nigeria back into normalcy. The role that UNICEF play in this and I'm often asked about this, why does UNICEF work with COVID-19 vaccine, is globally we work on vaccine management and risk communication and behavior change. That is reflected here in Nigeria as well. And our support to the NPHCDA, alongside our colleagues at WHO, is critical to ensure the success of that program. However, it is your role which is indispensable in providing accurate and motivational information and dispelling rumor and misinformation to your people and your constituents. In a world where people can easily get lost in the abundance of information and rumor, you are the guiding light to those communities, and you have demonstrated that already so far. With the Moderna vaccine rollout, we have nearly reached 100,000 per day in utilization. The AstraZeneca has also reached nearly 20,000 per day in utilization. This is a phenomenal success without which, without your support, would not be possible. Nigeria has a very good immunization infrastructure right across the country, and exceptional leadership in the NPHCDA and the Executive Director of the NPHCDA, Dr. Faisal Schwab. The government in 2020 took the steps and had the foresight to be able to buy in both equipment and vaccine at a time when the rest of the world were asleep and were focusing on COVID. Nigeria is very well placed to build back stronger in the immunization field, and it's critical at LGA level, which is where you come in, to bring in the accountability as well as the behavior change and social mobilization to ensure that the two come together very well. As my colleague from WHO has quite rightly highlighted, polio in its various forms, and environmental polio at its fore, is here with us. 120 children so far have been affected in 2021. Nigeria accounts for 70% of polio cases across the continent. The outbreaks have not only happened in the north, throughout the country, and the government of Nigeria and its partners have responded exceptionally well. If I remember the latest figures, 78 million vaccines have already been utilized throughout Nigeria. Another 50 million are expected over the next month or so to counter the outbreak. We're implementing the outbreak response to contain the spread of these diseases, just like when we were fighting wild polio together before. And in the same way, we need to come together to fight this, both the pandemic, the polio, and also to strengthen routine immunization. The long-term solution out of the recurring outbreaks is to ensure that all communities have the protection that immunization affords to them. I plead to you to continuously persuade the community in your Friday sermons, Quranic studies, and other religious fora, in your engagement with your constituents at community level on the importance of routine immunization, of which polio, COVID, and other vaccines are now an integral part of the primary healthcare system that affords to take it. My respect for you all, my humility in front of you all is taken. We can work together and we can build back together as in partnership to ensure that Nigeria is able to immunize all its children, its adults, and protect the communities from the various preventable diseases that have occurred. Thank you very much.
Indeed, my first time attending this, a kind of very important forum. I missed the opportunity on the previous one, as I am just new in the country. But before coming here, I heard a lot of great achievement that the country achieved through these kind of innovative approaches, building trust on traditional leaders to tackle issues that their own communities are facing. And I really want to congratulate you, the entire Nigeria, for contributing, number one, to end the white polio. This has been a worldwide success. I would like really to clap again, once again, for you. We are sure that this first step of success should not allow us to sleep and wait, as we need to continue. And we really welcome this kind of forum where people can continue to meet, reflect, and review on their achievement. So we at the Bill and Melinda Gates Foundation would like to reiterate our commitment to work with Nigerians, including traditional leaders, in their respective role to support the government initiative to strengthening primary healthcare service delivery. Thank you so much, and God bless you.
I must say that your paternal guidance over the years has contributed immensely to the modest successes that we have achieved thus far in primary healthcare. The first phase of our strategic COVID-19 vaccine rollout witnessed complete utilization of all available doses of vaccines due to your support in the sensitization and mobilization of the community for vaccination. The second phase, which is currently ongoing, will also require our traditional leaders to champion the cause towards vaccination and ensure Nigeria returns to normal living. We encourage you to use your influence to disseminate the right information and dispel any misinformation on the vaccines. Last week, we completed 1 year as a white polio virus-free country. This achievement is due to the collective efforts of all of you, our royal fathers, steering the boat of leadership to ensure vaccination is widely accepted by all. Distinguished ladies and gentlemen, can we give our royal fathers another round of applause? I would like to state without any doubt that Nigeria's white polio virus-free certification is not under any threat. I would also like to use this opportunity to once again appreciate His Eminence, the Sultan of Sokoto, NTLC members, and all traditional and religious leaders across the country for the sustained support and continuous mobilization of the community to ensure that we remain white polio virus free. Your Highnesses, I am glad to inform you that His Imperial Majesty, the Ooni of Ife, Oba Adeyeye Enitan Ogunwusi Ojaja II, is providing leadership in the systematic engagement of traditional leaders in the Southwest with the inauguration last week of the Southwest Traditional Leaders Committee on Primary Healthcare Delivery by the Honorable Minister of Health, Dr. Osage Ehanire, on the 2nd of September 2022 at His Imperial Majesty's Palace, Ile-Ife. This shows that our traditional leaders have the interest of their communities at heart and are collaborating with the government in ensuring basic healthcare services are available to the people. Apart from the inauguration of the Southwest Committee on Primary Healthcare, we have also scheduled the inauguration of the South-South Committee in the coming weeks. And I hope that we'll be able to invite some of the northern traditional leaders to be part of this ceremony. We want to seize this opportunity to thank the Northern Traditional Leaders Committee for their leadership that has sustained the work that we do around primary health care. This is what has inspired other traditional leaders to come into the fold as we ensure that in every geopolitical part of the country, we're able to have a platform where traditional leaders can discuss issues around primary health care, that part of healthcare services that is closest to communities. It is in the spirit of integration that we have adopted what we call the PSI, that is Primary Healthcare Services Integration, which uses the whole of family approach for our COVID-19 rollout. Your Royal Highnesses, distinguished ladies and gentlemen, with different disease outbreaks that we're currently contending with, it is imperative that our approach becomes more integrated. This is because they are all interwoven. Amidst COVID-19, we have cholera, we have CVDP2 outbreaks. These CVDP2 outbreaks is as a result of suboptimal routine immunization in part of the country, but primarily because of poor water and environmental sanitation. It is therefore very critical that as we conduct our outbreak response campaigns, we need to find a way to integrate our responses for efficient utilization of available resources and to enhance confidence in our people. Integration will also enhance our determination to continue to safeguard our white polio virus-free status. Consequently, Your Highnesses, mobilization, sensitization, advocacy, and role modeling efforts should target multiple interventions simultaneously. Your Highnesses, distinguished ladies and gentlemen, I want to humbly remind those who are yet to receive their second dose of the AstraZeneca vaccine that it is now available in all states across the country, while the Moderna vaccine is also available for those who are yet to be vaccinated. After vaccination, we want to encourage all Nigerians to continue to observe COVID-19 prevention protocols by wearing face masks, observe hand hygiene, physical distancing, avoid crowds and unnecessary travel until we're able to achieve herd immunity. Your Highnesses, I look forward to benefiting once again from your wealth of wisdom as you deliberate on issues that will make Nigerians healthy and strengthen our primary healthcare system. I thank you for your attention.
About the vaccines in Nigeria. And I want to believe Nigerians are really going out themselves to request for it. In my state, and from all the responses I had from my colleagues, there is every hope that the vaccine stock we have at the moment will be exhausted, will be taken by this country. But what we intend to do as a committee is, one, to lead by example. I have taken my 2 shots from the onset, and I believe every member of the committee has taken. And we've also advised and guided our councillors and members of emirate councils to also take. Most district heads and village heads have taken. These are leaders of our community, and the people have trust in them. And being the first to take, we will ginger other followers to also accept to take. Apart from this, we've also been talking to people about what we believe to be the position of the vaccines, that they are safe. COVID-19 is safe, is in this country, it is dangerous, it kills. And the only cure, the only preventive measure available to everyone at the moment is the vaccine. So we're leading by example. We are also talking directly to the people. We are bringing in traditional, other traditional leaders on board. We are bringing in all religious leaders that can influence people to also speak on the subject.